Hello, this is Dear Doctor, a YouTube channel where I talk about various health topics and issues. In this video, I will discuss mental health, mental disorders, and how they affect millions of people around the world. Mental health is the state of well-being in which we can cope with the normal stresses of life, work productively, and contribute to our communities. Mental disorders are conditions that affect our thinking, feeling, mood, or behavior. They can be mild or severe, and can interfere with our daily functioning and quality of life. Mental disorders are very common. According to the World Health Organization, WHO, 1 in 4 people in the world will be affected by a mental or neurological disorder at some point in their lives. In 2019, an estimated 970 million people had a mental disorder, with anxiety and depression being the most prevalent. The COVID-19 pandemic has had a major impact on mental health worldwide. Many people have experienced fear, anxiety, stress, grief, isolation, and uncertainty due to the health risks, lockdowns, social distancing, and economic hardships caused by the virus. A survey conducted by the WHO in 2020 found that 93% of countries reported disruptions or halts in critical mental health services as a result of the pandemic. Mental health is also affected by other factors such as violence, conflict, trauma, abuse, discrimination, and poverty. For example, studies have shown that childhood sexual abuse increases the risk of developing depression, post-traumatic stress disorder, PTSD, substance use disorders, and suicidal behavior later in life. Similarly, intimate partner violence and bullying victimization are associated with higher rates of mental disorders among women and adolescents respectively. Mental disorders can be prevented and treated effectively with various interventions. Prevention strategies include promoting mental health awareness, reducing stigma and discrimination, providing psychosocial support and counseling, strengthening social networks and coping skills, and addressing the root causes of mental distress. Treatment options include psychological therapies, such as cognitive behavioral therapy or CBT, medication, self-help groups, peer support, and rehabilitation services. However, many people with mental disorders do not have access to adequate care. The WHO estimates that more than 75% of people with severe mental disorders in low- and middle-income countries receive no treatment at all. There is also a huge gap between the need for and the availability of mental health workers globally. The WHO reports that there are only 9.1 mental health workers per 100,000 population worldwide. There is an urgent need for more research and investment in mental health to address these challenges. The WHO has launched several initiatives to improve mental health care and support globally. These include the Mental Health Action Plan 2013 to 2030, which provides a comprehensive framework for achieving universal health coverage for mental health, the Quality Rights Initiative, which aims to promote human rights and quality standards in mental health services, and the Special Initiative for Mental Health 2019 to 2023, which focuses on expanding access to quality care in 12 priority countries. Mental health is an integral part of our overall health and well-being. It affects how we think, feel, act, relate to others, and cope with challenges. Mental disorders are not a sign of weakness or failure. They are real and treatable conditions that can affect anyone at any time. We all have a role to play in promoting mental health awareness, reducing stigma and discrimination, supporting people who are struggling with mental health issues, and seeking help when we need it. Thank you for watching this video. I hope you found it informative and helpful. If you have any questions or comments about mental health or mental disorders, please leave them below. Please also like and subscribe to Dear Doctor for more videos on health topics.